I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 26. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today is depression. And unfortunately, the mainstream treatments for depression, well, not unfortunately, it's actually fortunate, is medication and therapy. And I agree with that 100,000%. I can't tell you how important that is to do that. However, we're talking about other things that might be the missing link that's causing the depression. In my offices, my doctors always want to get to the cause of the problem, not just treat the symptom. And that's why so many people come to us literally from all over the world. We have people call up every day. Oh, I'm coming from Japan. I'm coming from China. What's hotels near you? How do I get there? So I love the fact that people come in and see us from all over the world, but I also have to give you and them the tools to take home with them. Because we can only be your doctor for a certain amount of time. We're not with you all day, every day. And so we're talking about nutritional deficiencies that are linked to depression. And in a little bit, I'm going to talk about acid reflux, heartburn, burping, gas, bloating, and how that, I find, is the number one link to depression and brain malfunction, if I'm saying the right word there, and what you can do about that. If you have acid reflux and heartburn and burping and gas and bloating, it's not hard to get in there and work on that. It's pretty easy, actually. I'll tell you about that in a second. Let me cover a few more things here, and then I got it down here on my list. So, all right, antioxidant-rich foods. Plenty of fruits and vegetables associated with lower odds of depression and anxiety, and the effect ascribed to antioxidants that combat inflammation in the body. Here's a heavy-duty statement right here. Chronic inflammation is thought to be one of the primary causes of depression. Inflammation is thought to be one of the primary causes of depression. That's a heavy-duty statement right there. Because where do we get inflammation from? Well, you're in a car accident. You have a sports injury. You sprain your ankle. There's inflammation, of course. But food, the things that you do every single day, get into the bowels and cause an inflammatory reaction that can go systemic, which means it goes through the whole body. So if you're eating bad foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, every time you put those foods in your body, you're causing an inflammatory reaction. And that inflammation can go through the whole body, get into the brain, and can be linked to depression. So there's TV shows which just drive me insane, where a guy tries to eat as much food as he possibly can in a certain amount of time, and if he does it, he gets a T-shirt. Yay! Well, the first guy that was doing it on that show, I won't say the name of the show, he had to retire. His doctor said, you got to stop this, you're going to die. And I got a new guy doing it. So you're not supposed, I remember a comedian talking about this, you're not supposed to eat all you can eat. And you're not supposed to get stuffed and full and bloated. And most of us do that not once a day, but once a meal. So eating less food is going to be a key, and eating the right foods is going to be important too. So get on an anti-inflammatory diet. Well, what is an anti-inflammatory diet, Dr. Joe? Well, fruits, vegetables, nuts, and seeds. Dr. Joe Super Greens. The reason I created Super Greens is because it fights acid in the body. Most of us are eating a very high acid diet. And when you put acid foods in your body, it causes an irritation and inflammatory reaction. Also, it's sucking calcium out of your bones because acid foods, the 7 we just listed, need to be neutralized. And the body uses calcium as its primary neutralizing agent. So you're sucking calcium out of the bones, out of the blood to neutralize the acid. So if you go to an alkaline diet, non-acid alkaline diet, anti-inflammatory diet, essentially the same thing, you'll be amazed how good you feel. You'll be amazed how your brain starts to function more efficiently. It's not a secret what we're telling you here, folks. This is not like something, doctors have this special secret that they're not sharing. You ever read the tabloids, doctors know cure of cancer and they're not telling anyone. Well, no one told me either, and I'm a doctor. Was I not in that meeting? So an anti-inflammatory diet is so important, and that's why I recommend Dr. Joe's Super Greens and Dr. Joe's Essential Source as part of that diet. Because we've got to get those antioxidant-rich foods to help bring down the inflammation. St. John's wort. Now, St. John's wort is spelled W-O-R-T, not W-A-R-T. Wort is an Old English word for flower. So it's St. John's flower is what it is. They just call it wort, and everybody goes, it's a wart. No, it's not. It's a plant, historical use for depression. thought to work similarly as antidepressants. Now, if you're taking antidepressants, be careful. You don't want to start taking St. John's wort and the antidepressants. You might want to talk to a knowledgeable pharmacist, somebody who may have an understanding of both worlds and, the holistic and the allopathic, and say, okay, let's see if we can wean you off that. But that's something you got to work on. 5-HTP. This ties into the digestive system. I promise you I'd cover this. 5-HTP is a supplement. It's an alternative to antidepressants. I'm not saying do it instead of your drugs. When your body sets out to manufacture serotonin, it first makes 5-HTP. 5-HTP outperforms a placebo when it comes to alleviating depression, which can be a better results sometimes in the antidepressants. But let's go back one step further. If you have acid reflux, heartburn, burping, gas, bloating, I seem to cover this in every show I've ever done. You have a sheet of muscle called your diaphragm. Below your diaphragm sits your stomach. And food drops through the diaphragm into your stomach. You digest food and you pass it on. If your stomach is pushed up into that hole, the acid, the contents of the food can come up into your throat. So you might have acid reflux and heartburn and burping. You can also have hoarse voice. It can irritate your voice box. It can cause chronic sinus congestions, chronic sore throat, because the acid is coming up into your throat and into your sinuses. If you have that, it means you're not digesting your food properly. So we can do one of two things. One is we can take antacids, medication for it. Sometimes that's necessary. But if you ever read this fine print on those antacids, or not the antacids, all of them, I guess, or some of them, I shouldn't say all of them, but some of them, some of the fine print is that it prevents you from properly absorbing calcium, B12, iron, and magnesium. What? Yeah, you can't absorb calcium, B12, iron, and magnesium. What did we just talk about with B vitamins being so important for depression? So by taking those medications, that could enhance depression. And you need your stomach acid, because what the pills do is they shut down your stomach acid, slow down your stomach acid production. You need the acid to break proteins into something called amino acids. Now, the amino acid tryptophan combines with vitamin B6, remember the B vitamins, and creates a chemical called 5-HTP, which we just talked about. 5-HTP becomes serotonin in your brain. Serotonin is the neurotransmitter that helps you fight depression. Serotonin becomes melatonin, which helps you sleep, which is why most people with depression have trouble sleeping. So we can either take 5-HTP or melatonin or serotonin or whatever we want to do there, or, novel idea, fix the cause of the problem. And the cause is oftentimes the stomach pushing up against the diaphragm. So we gently massage or pull the stomach down away from the diaphragm, moving it to its normal position so that the stomach can start digesting food again. When my doctors test patients, and we've done many tests on this, about 80% of the patients that we test have some form of digestive problems. And once you fix somebody's digestive problems, they want to name their kids after you. They become so excited. And the reason I talk about this so much is I suffered from this for years. And I remember being a little kid, some of my earliest memories, I can think of it right now, sleep in my single bed in Carlstead, New Jersey, and my heart would race, ba 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 ba, and then it would stop. And then it would skip beats, ba 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 ba, and then it would stop again. And I remember thinking, I guess everybody's heart does this. You're a little kid, whatever, 7, 8, 10 years old. I guess everybody's heart does this. I don't know. I'm alive, so I guess it's okay. And what turns out, if the stomach pushes up against the diaphragm, you irritate something called the vagus nerve. Vagus nerve, not Las Vegas, VAGUS, this nerve. And it controls your digestion. It can control a lot of your brain, and it controls your heart, helps control your heart. And so when my stomach was pushing up against my diaphragm, I must have been irritating the vagus nerve, and my heart would just beat erratically. I see a lot of patients with high blood pressure, skinny people, in shape people who eat right, who still have high blood pressure. And people come to me and say, Dr. Joe, I'm eating right, and I'm doing everything you say, and I still got high blood pressure. So then we check the stomach, we pull the stomach away from the diaphragm, and in many cases, the blood pressure normalizes, taking the pressure off the vagus nerve, which is affecting the heart, which is affecting the blood pressure. Pretty neat, huh? Got a little algorithm there. And so if we can get the body physically tuned up, along with chemically tuned up, a lot of these cases of anxiety, depression, ADD, ADHD go to the wayside. And again, don't stop your medication, don't stop your counseling. Let's work together and co-manage your case if you have this. But I can't tell you how important it is to get that digestive system working. I always say, in order to have good health, you have to have a normally functioning nervous system. And as chiropractors, we work on the nervous system, pinch nerves, normally functioning digestive system, and good nutrition. So I'm making as easy as possible as I can for you. Nutrition-wise, Dr. Joe's Super Greens and Dr. Joe's Essential Source, absolute minimum amount of nutrients that you need every day. I add my B vitamins to it. I add Dr. Joe's Adrenal Support as well. And in the winter, I add vitamin D. That's my supplement protocol. That probably is a good one for you too, especially if you're over 30 and you have a lot of stress, you drink coffee. The adrenal glands have a tendency to burn out and you need to give them a boost. So I take Adrenal Support. The adrenal glands also produce anti-inflammatories. What did we say earlier? Chronic inflammation is thought to be one of the primary causes of depression. So your adrenal glands produce prostaglandins, which control inflammation. And if you're not bringing down that inflammation, it can contribute to the depression. So the adrenal glands are really important to get the workout, to make it work right. So that's why we have Dr. Joe's Adrenal Support. I created the supplements that you need. We got a probiotic. Most people, and if we have time, we'll talk about that. Most people don't have good bacteria in their colon. We have a way to recolonize your colon. So we have all those supplements on the website, drjoe.com, also available on Amazon. And it's not unheard of for people that are very depressed to start getting better. That's usually what happens when they get the nervous system working, get the stomach and get the digestive system working, and get on good supplements. And it's kind of cool because years ago, chiropractors, we were the quacks, we were the idiots, we didn't know what we were doing, we weren't real doctors, we were witch doctors. And now major universities are asking me to come speak, to teach, not just speak, to teach the students, teach the doctors. How cool is that? And I'm excited about that because that bias, that stigma is done. It's over. It's all done. Everybody gets along nicely. Just last night, as a matter of fact, I had dinner with one of my medical doctor friends, and we share thoughts. And, hey, what do you do for a case like this? What do you do for a case like this? So it's really nice that you, the patient, is benefiting the most with this, the end of the feud, so to speak. And a lot of it is ignorance. A lot of people didn't know what the holistic world was. They thought it was like, chicken bones and voodoo. And it's like, well, that could be part of it. I don't know. I don't do that. But now we're getting the nervous system, digestive system, nutrition together. People are getting real excited, and that's pretty cool. So we're talking today about depression, things that you can do to help with depression. And we're going to continue on now with probiotics and prebiotics. These are good bacteria. Let's first define what they are. Probiotics are the good bacteria in your colon. And 80% of your immune system is in your digestive system. So you got to make sure you got a lot of good bacteria in there. Prebiotics feed the probiotics. You can eat a prebiotic, fructooligosaccharides, inulin. I like saying those words. You can't utilize that. It's not a food you can use, but the bacteria in your colon can use it. They eat it, and they get healthy, and they spit out their waste products, which is what you really digest. You don't digest what you eat. Your bacteria have to spit out what they don't want. This is simplified, of course, and then you absorb that. But the prebiotics feed the probiotics so that they get healthy, and they make more probiotics, probiotic babies, and then you have lots of probiotics running around. But your mental health is so closely linked to your gut health. And this should just be plastered over every newspaper, every news report ever. But that's right. We're sharing it together, and that's what's really important. Number of studies confirm chronic inflammation, especially in the gastrointestinal tract, can play a critical role in developing depression. Once again, back to the inflammatory conditions. Research have suggested depression may be a neuropsychiatric manifestation of chronic inflammatory syndrome. So depression is just a byproduct of having an inflamed body. What causes inflammation? Well, stress, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, perfume, hairspray, deodorant, room scents, carpet cleaners, new car smell, pollution. I don't like perfume. I cannot do perfume. I beg, please, folks, if you come see us as patients, I'm going to beg you, please don't wear perfume or cologne because I just don't like it. And I'm amazed how this stuff doesn't wash off your hands. I don't know what it's made with, but it's like super. It doesn't come off your hands at all, ever. And I had a patient come in the other day, and she was very depressed. And we talked about her digestive system. And as soon as I walked in the room, she started crying. And I thought, usually women cry after they get to know me. I'm not used to women crying before they get to meet me. And so she kind of chuckled a little bit. And we talked about it. And I said, one of the things you have to do is not wear perfume anymore. And she said, but I like perfume. I said, what's more important to you? She said, I'll do anything to get well. I said, you got to cut out your perfume. But I smelled it on her. And she said, I didn't even put any on today. It was in her skin. And she was clean. She must have showered. So I really want you to try to get away from those artificial smells. But that can affect your health as well. Your gut is considered a second brain. They're created from identical tissue as your brain when you're born. Mommy and daddy come together, sperm and egg come together, the brain and the spinal cord form first, then they send out little branches. Those branches become peripheral nerves, it's called, and they form different organs in the body. But the same type of cell that forms your brain forms your gut. So they work very closely, and they're regulated. They work together. Now, serotonin, we talked about that neurotransmitter. 95% of the serotonin in your body is not used in your brain. It's used in your gut. Again, it's the same type of cells, so they need the same type of chemicals. So most of the serotonin is being used in your gut, not your brain. So if you don't have enough serotonin, who's going to lose? Well, the brain. It only gets 5%. So we've got to make sure that we get the gut working properly and the good bacteria. That's why we have Dr. Joe's Digestive Enzymes, which we use to, if you eat, whenever I eat a cooked meal, I take Dr. Joe's Digestive Enzymes. I eat a lot of raw food, though. And probiotics and prebiotics, and we have that as well. And anyone that's ever been on antibiotics, if you eat a lot of meats or dairy products, a lot of commercial meat and dairy products are high in antibiotics. So you get into the body, it kills the bacteria, you got to recolonize. So the prebiotics and the probiotics are something else that I use very often, and I give to my patients as well. Now, folks, if you want to come see us, I know a lot of people say, well, Dr. Joe, I want to be your patient. I've got neck pain, back pain, car accident injuries, sports injuries. I've got digestive issues. If you want to come see us, we'd love to have you as a patient. We have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. So go to my website, drjoe.com. You can set up an appointment to come see us. And we will verify your insurance. Don't get nervous. Give us the information. We'll tell you what's covered and what's not, because insurance is so confusing. It's more confusing every day. So let us help you with that. But we want to get you well, because so many people come to me every hour when I'm seeing patients, every hour of every day, and say, Dr. Joe, why didn't I do this sooner? Why didn't somebody else tell me that you can pull the stomach away from the diaphragm and that helps digestion, which can help produce neurotransmitter production, which helps my brain function? Why didn't somebody tell me that Dr. Joe's Super Greens and Dr. Joe's Essential Source are the end-all, be-all supplements that are ever created? This is their words, not mine. I think it's true, too, though. And I don't know how I've lived without this stuff. And my answer is always, I don't know. So we'd love to have the opportunity to have you come see us. Go to my website, drjoe.com, and you can make an appointment, and we'll get you set up right away. We usually get you in a very, very short period of time. So we're talking about depression today and things that you can do. I do want to talk a little bit about the physical aspects of depression. In your neck, you have nerves that come out of your neck, and some of them go back up and help control your brain. Your brain stem, well, your brain kind of funnels down into your spinal cord. And that area where it's funneling is called the brainstem. And the upper part of your neck, right below your skull, it's called the atlas and the axis and the occiput. If they move out of place, they can actually put direct pressure on the brainstem, which can affect your brain function and your moods. So a lot of patients, when they get chiropractic care with us, say, Doc, I feel so much better and my depression is getting better. So there's a physical component of depression, pinched nerves, stomach up against the diaphragm. There's the chemical expression of depression, which is the food. We talked about probiotic deficiencies, vitamin D deficiencies, B vitamin deficiencies. At least, I'm begging you, take Dr. Joe's Super Greens and Dr. Joe's Essential Source. So let's get the chemical and let's get the physical addressed instead of just addressing the pharmaceutical. Not against the pharmaceutical. If you need them, take them. But imagine a world where you don't have to take medications. I always laugh. At my age, I'm old, I go into doctor's offices if I get an exam, my eyes examined, whatever, and the doctor will say, okay, give me a list of your medications that you're on. I said, I don't take any medications. They said, well, what do you mean? I don't take any medications. Well, at your age, you have to be taking medications. No, I don't take anything. And I haven't. I mean, if I had a headache, I might take an aspirin, but then I'll go get my chiropractors to adjust me to find out why I have a headache. So it just blows everybody's mind that I'm old, as old as I am, and that I don't take medication. The only surgery I ever had was tonsils. So it's not hard to get well. It's actually pretty easy if you know how. And with depression, it's not that hard in many cases. But the problem is that you're depressed. So you don't want to do things. So getting out, getting sunlight, moving around, getting exercise, the B vitamins, the right foods, staying away from the bad foods, the sugars, the artificial sweeteners. Yeah, it's a bit of a commitment, folks. Do I miss my meatball sandwiches and double beef cheese hamburgers? I do. It's been 32 years since I've had one. Would I ever do it again? Absolutely not. If you knew what I knew, you would do what I do. And when patients come to my offices, or we do consultations over the phone, I always say, I understand you're not going to be as crazy as I am, but let's see what you're willing to do. Well, you know, Doc, I can give up my artificial sweeteners. Great. Let's take that first step. You know what, Doc, I can start drinking more water. Great. Let's do that. I can take Dr. Joe's Super Greens, Dr. Joe's Essential Source, B vitamins, and adrenal support. Great. Let's do that. And then once you start seeing the results, it's great. The biggest problem we've ever had with patients in all the years I've been in practice are the ones that don't follow the treatment plan. And I was covering for a friend of mine another show. And somebody called up and said, my husband went to the chiropractor twice and it didn't work. I said, did you ever go on a bad date? Yeah. Did you stop dating? No. Okay. It's not going to change in 2 visits. Nobody's that good. I'm not that good. My staff isn't that good. Now, sometimes we had a patient come in the other day, dizzy for 30 years. We adjusted his skull. We adjusted his neck, adjusted his jaw. He didn't tell us he was in a car accident. Half his jaw was made of plastic surgery. His jaw was out of place, causing a dizziness. Well, that was one of those miracles. My dizziness is gone. But we took x-rays of him. We still have to work to make the corrections of all the damage that's occurring. Because the x-rays don't lie. X-rays are x-rays. So we've got to work on getting that fixed. So if you want to come see us, drjoe.com, we'd love to have you come in. Cholesterol levels. Now, this is important. Your cholesterol can be too low. No one's ever said that before, Dr. Joe. What do you mean my cholesterol is too low? Well, make sure your cholesterol is in the normal range. Because if the cholesterol gets too low, you need cholesterol. In fact, low cholesterol is dramatically linked to increased rates of suicide as well as aggression toward others. Increased expression of violence towards self and others may be due to the fact that low membrane cholesterol decreases the number of serotonin receptors in the brain, and the brain is approximately 30% cholesterol by weight. So if you don't have enough cholesterol, you reduce the amount of serotonin receptor sites so you can't absorb the serotonin, and the serotonin is the neurotransmitter that helps you calm down. Remember, serotonin becomes melatonin, which helps you sleep, which is why a lot of patients that I've seen over the years who are on cholesterol medications have trouble sleeping. Wow. How's that for a roundabout way to get somewhere? So low serum cholesterol concentrations can contribute to decreasing brain serotonin, which not only contributes to suicidal associated depression, but prevents suppression of aggressive behavior and violence towards others. That's heavy-duty stuff right there, man. Once again, I'm not against you taking your medication. What I'm against is making sure that you're not in the what we call the Goldilocks zone. You're in the perfect place where you need to be. Exercise, we talked about that. You got to get out and start moving. Exercises create something called GABA-producing neurons, which help reduce the natural state of calm. GABA is a neurotransmitter in your brain, just like serotonin and dopamine, that calms you down. It suppresses other neurotransmitters, including pain. So if you're in pain, getting moving, I know it's counterintuitive. I'm in pain. I don't want to get moving. The more you get moving, the more GABA neurons you're going to produce, GABA-producing neurons, which will help suppress your pain and calm you down. Now, when I say exercise, you don't got to put on your tights and do a let's get physical dance with Olivia Newton-John. What you can do is just go for a walk. Do housework. Come to my house and do housework, even better. But just get out there and start moving a little bit. And once you do a little bit, you'll get more and more. Just like when I have people try to change their lifestyles. Start with the super grease. Start with the essential source. Let's start there. Okay, how'd you do for a week? I like that stuff, Doc. It tastes really good, and I noticed that I am feeling a little better, a little more energy. Great. Now let's add a piece of fruit to your breakfast. Okay, I can do that. Now let's cut out the bacon and eggs. Okay, I can do that. So it's a step-by-step process. Another thing I want you to consider, kind of running low on time here, is electromagnetic frequency. Those are electromagnetic waves that are put out in the air, and it's from Wi-Fi, it's from your cell phones. What I do in my house is I have a timer. I put a little timer. You buy them in the grocery store or whatever for $8. And I set the timer and I shut off my Wi-Fi every night at about 10 o'clock. And it doesn't come back on again until about 6 or 7 in the morning. The timer automatically shuts it off and turns it back on. I don't even have to think about it. Because when you're sleeping, I want you to get away from as much electromagnetic frequency as possible. And why not just shut off your Wi-Fi? It's pretty simple. And you can do that. Little timer. $8-10. It's amazing how that works. Your cell phones, if you ever read your cell phone directions, it says, do not put this next to your ear. No one has ever read the cell phone directions. I know that. I have. I don't have much of a life. But don't put the cell phone next to your ear. You want to use a wired headset. Not a wire-free one, not a one that doesn't have wires in it, a wired headset. I have them in my house, I have them in my car, I have them in my office. So you lose them, you break them. They cost $6, buy a new one. But you don't want to put them next to your head, especially if we have things like depression. So, folks, if you want to listen to this show again, I know I covered a lot. Go to my website, drjoe.com. You can go to our podcast is called For the Health of It, so you can catch that on your podcast apps that you have. If you have questions, send them to me through the website, drjoe.com. If you want to make an appointment to come see us, drjoe.com. If you want to get Super Greens, Essential Source, the B vitamins, the probiotics, all my supplements, all my books, I didn't even talk about my books today, they're on the website as well, also available on Amazon. Try to make it as easy as possible because my goal, my doctor's goals, are to help get you well and keep you well. And so that's why we have the website there with hundreds of hours of videos and audios, the podcast for the health of it. Because I want you to have this information. I want you to share it with your friends because this is healthcare that really, really works. Over 3 decades of practicing, seeing thousands and tens of thousands of patients, I can tell you what works and what doesn't. So folks, got to run. Time's running out, and catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBradio.com and on a WSB Radio app.